While we're waiting, this is Dr. Holder. Thank you for coming to our youth sessions. This is our last one in our series, but we do have them on tape for anyone who's interested in seeing the tape series that we've done. We have them recorded. So like the youth ministers who are on and the students, if there are things you want to show again to your group, just contact us and we can get you the link and you can use it in your group sessions because we have great sessions on mask, on implicit bias, on what else about the coronavirus, lots of things that you could share with your youth who weren't able to come. So just let us know, let Sancha or Bridget Sewell know, and we will get the information out to you. So thank you for coming.
Yes, thank you, Dr. Holder. And as she said, this is our last session, the last of 6. I see many familiar faces, or at least the names. If I can't see your faces, it's fine. I just want to get started by introducing myself again and the team that's helping us today. So my name is Chantal Roll. I'm a member of the FIU SNMA chapter, and we've been responsible for doing these sessions. And with me, I have Jennifer Knight, Gamily Antonio, and running the session today, luckily we have Adriana, Javier, and Lorianne. So I'm so grateful that they've been able to come and help us with this, and they're going to take over.
Hey everyone, my name's Adriana. I was the one helping out with the presentation last session. So if you see my face and think it's familiar, that's why. And it's so great to see some familiar faces there today as well.
Okay. Hi everyone, I'm Javier. I'll also be presenting today along with Adriana and Lorianne, and super excited to be here. And before we get started, I just want to say that I would love for everyone's participation. We have a couple of interesting activities today, and we would love to hear your feedback, okay? So our presentation today, we're going to get started, and it's going to be about giving back and ways to get involved in our communities during COVID. So okay, so to get started, so here are some of our learning objectives, and hopefully by the end of this presentation, if we communicate clearly enough, everyone who participates and is listening to us and will know a few ways to give back to the community and to be involved. And more importantly, hopefully, we will re-emphasize some of the ways that we can stay safe and some of the ways we can get involved safely during COVID. For this session, we're going to try something where kind of interactive, where you guys can annotate on the screen or write on the PowerPoint. So if we could just take a couple minutes and sort of test this out. If you guys hover over the top of the screen and hit annotate and just write on my screen, anybody who can do it, I would love the participation. Just go ahead and write on my screen and see if this is gonna work out this way. Okay, I see Mia saying hello. Hi Mia, thank you for participating. Can anybody else do this? Hi, Dr. Holder. Thank you for annotating. Okay, now let me see if I can clear annotations. Okay, so I'm going to clear all the drawings. So we're going to use that feature more or less. Oh, thank you for annotating. Let's see here. Where is this? Clear all the drawings, and we're going to move. We're going to move to the next slide. Thank you guys for participating. Okay. All right, so to start off the activity, I'd like to ask, what do we see here? Let me pull up some of the faces in the group. Can anybody unmute and sort of tell me what they see here?
Service, community service, chores.
What was that? Let me see. Mia, thank you. Yeah, we see community service. We see
People working together.
I'm sorry?
You see people working together.
Yeah, absolutely. Yeah, we see people doing chores, doing community service, working together. What else do we see? We see people helping others, right? This is kind of like at the core, at the root of giving back to our community and working together, doing sometimes chores, important things around the community is an excellent way to give back. And so these pictures, these clip arts kind of like share some of those key elements. And kind of like my next question would be, this is an annotation slide, this is what we were beta testing earlier. Can anybody share with me some of the experiences of them giving back to your community, or maybe share some of the ways you're involved in community service? You can unmute or write in the chat or annotate the screen, however you like.
I started a little food box for our school because we don't have much of it's not a very big school, but I started growing some herbs for us and it actually took off pretty well. Nice, Philip. Thank you for sharing. Okay, so you grew herbs at your school? That's really interesting. And how's that going? I'd say pretty great. It wasn't started too long ago, but they really took to the soil. So I think it's going pretty well. Yeah, over at the medical school, we definitely, we did some service projects where we did something similar and we started a garden. So that's really cool that you did that at your school. It's awesome. Does anybody else have any ways that they've been involved recently or in the past, or if, here I have, move the things out of the way, making soup and delivering it to the elderly who haven't been able to get out. Wow, that's also like super important contribution and a way to get involved. I didn't see who wrote that. Thank you for participating. Oh.
My wife and I have been making masks and giving them to our mission ministry when they go out, evangelism team.
Wow. Okay. Yeah.
Pass out masks. You know, we do fried chicken and bread and water, and we pass that out also.
That's fantastic. Thank you for sharing. Yeah, definitely. These are all that are super important, especially during these times, during times of COVID, and people are isolated, and definitely making those connections can be super important.
Javi, I saw Kalima was starting to write something, but I think it might have gotten erased. Not to put you on the spot or anything, but I saw writing. If you feel comfortable sharing.
It's okay. It's okay. It got erased, but I'm in an internship right now. We're still in the planning stages, but right now we're putting together different marches, different sit-ins for city halls, and different things like that. We're still in the planning stages, of course, because that takes a lot of planning, but yeah, that's what I've been doing recently.
Wow. That's fantastic. Thank you for sharing. Let me see here. So like the next part of this sort of little talk, it's hard, right? Like it's these last several months that we've been in quarantine and we've been dealing with this global pandemic. It's been kind of difficult to give back to the community, because giving back is something that always makes us feel good, and it makes us feel a certain kind of way when we help those who can benefit from our help. And unfortunately, the quarantine and COVID has made this very difficult. And above all, we have to value our safety first so that we can help others in the future. So some of the students in the group, what are some of the COVID-19 safety guidelines that you guys have, that you guys are aware of now? For example, wearing a face mask in public, that's like the new normal. Whenever we go out to do groceries or go out to school, we have to wear our face masks. Can somebody unmute or annotate or write in the chat some of the guidelines that you guys are following now to stay safe?
Stay 6 feet from people who are sick.
6 feet apart. Thank you, Valencia.
You're welcome.
Why 6 feet? Can anybody like guess why 6 feet?
They don't want to spread it.
It's harder to spread bacteria when you're that far apart.
Yeah, exactly. Valencia and Mia, thank you for participating. Yeah, definitely. You want to stay a good distance away from people, so you don't spread. Okay, let me try to pull it. Okay. So wearing the face mask, staying 6 feet apart. Can anybody think of any other guidelines?
There's been a lot more cleaning going around. Like everything has been wiping it down as soon as you touch it, or really just anywhere.
Yeah, absolutely. Like disinfecting your area. Like I don't know, Philip. I don't know if you're going to school where they're doing this, but definitely over at the medical school, when we get to our classrooms, we wipe stuff down and we do our class, and then when we leave, we wipe stuff down again, and everything is just, everybody's extra careful now, which is great. And yeah, definitely that's one way to stay safe and keep others safe as well. How about something else? Anybody have anything else that they can think of?
Like self-quarantining, like when you're experiencing some of the symptoms, quarantining yourself, being able to take that sacrifice.
Yeah, Ibrahim, definitely. Self-quarantining, that's like the most responsible thing we can do, right? Especially if we're feeling sick or we're feeling kind of under the weather and we're really not sure. Staying home and away from others is definitely one of the best ways to stop the spread of this virus. Absolutely. So let me flip to the next page here and see so these are some of the things that we came up with, right? So like some of us said, maintaining 6 feet apart, wearing a face mask is super important. And it's also very important not to wear it up to here, but you cover your nose, right? Because the virus lives in our nose and our throat. So definitely we cover both. We wash our hands with warm water and soap. And when that's not available, we use alcohol sanitizers. If you cough or sneeze, you do it into your shoulder or into your elbow so that particles don't go everywhere. Definitely avoid touching our eyes and our nose because when we do that, like if it's on our hands and the virus gets in through our eyes or our nose, like, we can get sick and spread that to others. We avoid social gatherings, right? We try, and that's hard for certain things sometimes, but we've been trying to avoid like large gatherings, and definitely we're staying at home if you feel sick, or self-quarantine is so important. Okay, guys, thank you so much for participating. That was awesome. Adri is going to do an activity with you guys now. So Adri, please take it away.
All right. Well, I just want to say thank you guys so much for, continuing to speak up, to volunteer and interact. It makes things so much better to hear you guys, talking. And thank you guys so much for sharing about all of the volunteering you guys have already done. I'm blown away at just the diversity of the different things that you guys have done for your community already. So, thanks for sharing that. So what I'm going to talk about now a little bit is, how do we volunteer? How can we donate? Obviously, during COVID times, things are a little different, and it's also affecting the ways that we can volunteer. So as you know, we're going into the time that a lot of people say it's the season of giving. That doesn't only mean like money, it also means giving your time. Right? So we're going to talk about different ways that you can volunteer while also keeping yourself safe and keeping your community safe and your family members safe as well. So, the first way that you can volunteer is that traditional way of donating money online. So how do you think that this keeps you safe?
You're not interacting with anybody face to face.
Yeah, exactly, Mia. You're not interacting with anybody face to face. Javi, if you can go ahead and put, yeah, you're in charge of this. Perfect. Yeah, so you're not interacting with anybody. You can do everything online, so it helps you social distance and you still quarantine. So thanks, Mia, for that. The other way that you can volunteer, and this is something that you can always do every year, but it's extra important this year, is what's called letters of isolation. So it's sending letters to senior citizens who may be feeling lonely during the pandemic. And so before I ask you how this keeps you safe, why might this year senior citizens be feeling extra lonely?
Because they can't really spend any time with their family because they're quarantined, and as the doctors in the news say, they're most likely to get COVID-19.
Exactly, Raheem, exactly. You know, this year is especially difficult because the holidays is usually the time that everyone gets together, but because we care about our senior citizens and we're keeping them safe, you know, we have to unfortunately stay away. So you've hit the nail on the head. That's exactly why they're going to be feeling more isolated. So how does sending these letters of isolation, how does this keep yourself safe and your community safe? Anyone out there want to give a chance? Okay, that's okay. You guys have kind of talked about this already. You know, sending a letter doesn't involve actually directly interacting with anyone, and you're keeping those senior citizens safe. And at the same time, you can support the post office, which is important. Support your local post office. So that's just an added bonus. Another thing that you guys can do, you know, this is also something very unique to COVID, but also really important. I'm sure you guys have heard about healthcare workers and essential workers. They've had, you know, a really tough time this year. They're taking care of COVID patients. They're doing a lot of work. And unfortunately, they're getting extra work now during the holidays because, you know, things are getting a little bit worse. Cases are going up, right? And so something that you can do this year is volunteer your time and send thank you messages to the people that have volunteered at food banks, for people that have, you know, been essential workers, for people that have been healthcare workers. So again, I'm going to ask, you know, how does this keep you safe? And it's okay if it's a really short answer.
Can you repeat the question again?
Sure. So, you know, the idea of sending a thank you message to people who have volunteered at food banks or that are healthcare workers, how does sending that thank you message, how does that keep you safe and how does that keep your community safe?
It keeps you and your community safe because, like, since COVID-19 is around and you might not know if you're infected by it, so sending a letter might be safer than you going up to them and spreading germs.
Exactly. That is exactly right. Great job, Valencia. Thank you for volunteering. Yeah, so sending a thank you letter, again, just like all the other ways, you know, you're not, you know, directly interacting with people, but you're still showing your support and you can keep yourself safe too. And you can also especially keep the healthcare workers safe so that they can keep on helping other people and the people at the food banks as well. Another way to volunteer that we want to highlight is through Runga. So you can actually purchase items online, kind of like a drive. So, you know, things that people need, you can actually like purchase it for them. It's kind of like online shopping, and you can really help out organizations. So I know that we kept on asking, how does this keep you safe? Does anyone, I know it's kind of like the same trend. Does anyone have a different take on that you want to share?
I was about to say, it benefits you because you're buying something for yourself, but the money goes to like a good cause to help prevent it or stop it.
Yeah, so with Runga, it's very similar. So with Runga, what you do is you don't exactly buy it for yourself, but you buy items that the organization might need. So that's how you would donate to them. So, you know, you're still allowed to quarantine and you're still able to help others. And so you're just purchasing things online that you would want to donate, but instead of purchasing it yourself in person and giving it to the organization in person, it's all online. It's kind of like the idea of like a wedding shower or something like that. I don't know if you guys have gone to your family events like that, but it's something similar. Perfect. And also, you know, you won't get the virus because it's online, right? So, you know, it's computer viruses obviously are not the coronavirus. All right, and then the last way, this is a little different than the other ways that we've gone through, volunteering at a drive-through pantry. So who can tell me, how does this keep you safe?
Here. car, so you're still likely, there's a huge possibility that you can still maintain this.
Yeah, exactly. Was that Mia? I wasn't quite sure. Okay, Javi's telling me that was Mia. Perfect. Thanks, Mia, for volunteering again. And that's exactly right. So people are coming in their cars, and that helps maintain that social distance. If both people are wearing masks, the person receiving, the goods and the donations, the person giving the donations, then that helps to make sure that you're being safe and you're following the social distancing protocols. So this is a nice way if you guys still want to be active, if you want to get out of your house and volunteer your time, this is another great way to get involved that's safe.
I have a question for the students and the members here. How can you do something for your churches and keep the church and yourself safe? You guys are all from churches. What ideas do you have or have you shared with your church?
Necessarily complimentary phone calls, but just checking up on, especially like the elderly, checking up because they're alone during this time, and a lot of them have health issues and they fall in that risk age range. So just calling and checking up on them, sending them groceries, things like that.
Okay, that's a very good one, just calling them. I hear you've been hosting Zoom. Kalima says you've been hosting Zoom. What about for each other for kids? What have you done for the children?
There's been a lot of like sorrow kind of going around because people haven't been able to see their friends and stuff. And I play an instrument, or I play with couple, and we have chapel. So that is a good way to kind of get the liveliness back into the church.
You play music in the chat room? I'm trying to get.
Hey, I play music in chapel. I play ukulele.
Oh, in chapel.
Yeah,
oh, okay. All right. Okay. And the kids listen in through Zoom? I'm trying to see how you keep everything safe.
We on Wednesdays we still have Bible study, but we social distance, and they line up the chairs inside of a bigger room, so then we have more space to kind of be separated, and we still are mandatory to wear mask. And I'm on the stage while we still play, and then after we're done, we kind of just go home because.
Okay, that's good. You're in the stage. We say like 20 feet away if you're doing any singing, because you sing and the mouth can come out farther with that extra force of singing. So it sounds like you good social distance even when you're singing. Or are you just playing the instrument? I don't know if you're singing with playing or you just play. Which one?
I'm just playing. I have no singing.
Perfect. Okay, so if you're not singing, that's perfect. Just playing, then that's 6 feet away. That's great. If you're putting any words and singing, then you definitely try and go 20 feet.
Yes, ma'am.
Okay, but no, that's great. Great ideas for your churches. Thank you.
All right, thanks, Dr. Holder, for that. And that actually kind of segues into like our next topic really perfectly. So this is a quick slide of just ways to give back. We've talked about all these things, and these are different ways if you're interested. These are links that you can write down. The traditional way of donating money online. Feeding South Florida is a great organization. They've done amazing work during the pandemic. However, if you don't have money that you can donate, which I understand because, you guys are students, and you guys can, again, just volunteer your time. So you can send those letters of isolation, you can send thank you messages, you can volunteer at the drive-through pantry as well. And Runga is the one that you could also donate money to. You can go to runga.com. You can start a donation drive, and you can do that for local organizations as well. So Javi, if you can move on to the next. Perfect. So Dr. Holder read our minds. Thank you so much, Dr. Holder, for bringing that topic up, because it segues perfectly into what we're going to ask you, which is, what do you want to do? So we've talked about different ways to volunteer, and you guys have mentioned amazing ways to volunteer. I see a lot of them is making sure that the youth stay connected and that there's some semblance of normalcy. Now that we've given you some other ideas, and you can also bring in your own ideas, because it sounds like you guys have really amazing ideas. What are some things that you might want to do this holiday season or beyond to volunteer? You guys can annotate or write in the chat or unmute yourselves.
I want to help other people and like just help them because some of them, they don't have enough people to like help them around, and they might need other people to help them. So I would like to help them for that.
Okay, that's great, Valencia. That is a great start. It's so important to think about helping.
I'm talking about you.
Oh, thank you. Oh, I think someone might have unmuted. But yeah, so Valencia, it's great that you want to help out. Remember to make sure that you're keeping yourself safe, keeping your family safe, that if you do help out in person, to maintain that 6 feet and to wear a mask. I see it kind of got overlapped. Someone put giving the homeless masks and some resources. Does someone want to talk a little bit more about that? I'm not sure who wrote that. If not, that's okay. You don't have to. And I see someone else. It kind of overlapped. Drives for families with kids that have had a loss of employment during COVID. A toy drive. Does anyone want to talk a little bit more about that?
Yeah, just going into the community, and I know a lot of people have lost jobs or had a downsize in their paycheck. So a lot of people won't have the typical Christmas, like on top of not being able to see family because of traveling. So going to the different homes in the community and looking for the need of, like, even though it's not a necessity, every kid should have a toy to play with. So just things like that.
That is beautiful, Mia, and that's such an important drive. I know toy drives, especially during the holiday season, bring a lot of joy. So I'm glad that is on your mind, and I hope that you can make that happen, especially this year. Like you mentioned, with a lot of people losing employment during COVID, they might not be able to afford toys, and so I'm sure that's going to be a great surprise for Christmas. Does anyone else have any other thoughts of what they might want to do? Promise you, we won't come knock on your door if you don't do it. Anyone else? Okay. Well, you guys have given some really, really great ideas, and I'm looking forward to you guys being able to explore it more. All right. So I'm going to go ahead and pass it on to Lori.
Sorry, I know the energy is a little low. It's the end of the day. So if you guys can just please turn on your cameras, and we're gonna do it like a light stretch. Just stretch with me. It's a long day, but it's the end of the day. I'm so happy to be here with you guys. Oh my gosh. So we spoke about something that's so important to just us as people, as communities, and that's serving and that's helping. So we're speaking about how we can help our communities. And now I want you to know that by helping our communities, we can also help ourselves. So I know that in this time of isolation, a lot of us are alone, and more times than none, or more times than you may realize, it might take a toll on your mental health. And doing community service is a good way to help yourself just feel better, to help others, and to also help yourself, because we are social beings and it really helps when we are together in communities. So I heard a lot of awesome examples about how you guys were able to do things in the community, and thank you for turning on your cameras. I love it. I can see your faces. So now I want to ask you, like anyone, you guys don't all talk at once. Tell me how it felt when you actually went on to help someone.
It was a good feeling.
Yeah. Why was it good? Can you elaborate?
It was good because now I know, well, now they know that they have someone to assist them when they need it.
Okay, thank you, Valencia. So that's very true. Like when you help people, it like gives them, it lets them know that there's someone in the world that's thinking of them, that there's someone that really cares about them. So anyone else, how did it feel? I can see some people speaking in the chat. Yeah. So I have, I'm sorry. I'm not sure who was trying to talk. I lost you.
It definitely made me feel like I had something other than just like self-centered stuff to do, because I play a lot of video games and it's nice to just go back and actually help somebody else other than myself.
Oh, that's great, Philip. I have brothers who play video games a lot, and it's nice to take some time out of your day, like leaving your room, maybe like seeing some sunshine and doing something good for others. So, Rose, I'm so sorry for butchering your name, but you said that you felt like a good person in the chat. So do you want to speak up on what you meant by that? We're not scary. No. Anyone else wants to speak up about how it felt when they did something nice for someone else? Okay, I got some excellent examples. So now I'm going to move on to another question. So this is going to be pretty deep. I want you guys to think about a time where you felt like you wanted help, and speak about how that made you feel. I'm not sure if someone is trying to answer the question. So you guys never needed help ever? Never?
I have.
Yeah. So do you want to talk about how that made you feel?
It made me feel, it made me feel good because when someone helps me and like they help me good, it's like they're trying to make me feel better and not frustrate myself on it.
Mm-hmm. Yeah, so when someone helps you, it makes you feel better. But those times that you don't have any help at all, like it's not really a good feeling. You feel lonely, you might feel sad, you might feel like no one cares about you. And unfortunately, because of COVID-19, there's been like so much isolation, obviously, because we know that the disease spreads through contact. And we've seen in the US like a spike in rates of depression, a spike in rates in anxiety and things like that. And I just want you guys to know that if you guys are feeling these feelings, if you guys ever feel lonely, if you guys ever feel anxious, you're not alone. It's something that's happening everywhere. And we don't want you guys to feel that way. And we also want you guys to know that you can make a difference in someone's life if they're feeling those feelings. Just think about a time where you I don't know, it's Christmas season, where you gave someone a gift, and think about like how your heart felt different, how you may have felt better and things like that. So we're going to move on, and we have a scenario. I want a volunteer who hasn't spoken to please read the screen.
Jenny is quarantining and is sad that she will not be able to spend the holidays with her father this year. This will be the first time not spending Christmas with him, and thinking about this makes her even more depressed. She remembers that as a child, she would wake up early Christmas morning, excited to open presents. Thus, she realizes that she could give another child the same experience and donates toys to her local church. After donating, she feels her spirits are lifted and fondly remembers holiday experiences she had in the past with her father and waking up to presents.
Thank you so much for reading. So I want you guys to just read this in your heads, or if you guys have read it already, think about the scenario. We have some questions that come next. So our first question, who can tell me how Jenny was feeling?
Sad.
Sad? Okay. So why do you think she was sad?
Because she couldn't be with her family.
Okay, that's true. She was away from her father. She really wanted to spend the holiday weekends with him, or the holiday week with him, and she wasn't able to do that. How else do you think she was feeling? Anyone else?
I feel like she felt alone, like even because she couldn't spend it with her father. That really did take a toll. It does do that.
Yes, that's very true. So she was feeling sad, she was feeling lonely. So how did she help herself feel better? Yeah.
By helping her, how about helping other people, or other children, or helping other children feel how she used to feel.
Okay. So she helped herself feel better by donating gifts, and she used to feel really happy when she was receiving gifts and when she was like having that Christmas experience with her family. So she went out and she did what, made her feel happy. And it wasn't that she was receiving anything, she was just serving. She was giving back to her community, and it really helped her feel a lot better. So for the third question, why did this help make herself feel better? And please speak about emotions and kind of put yourself in her shoes, and think about how it would make you feel better if you were Jenny.
I guess it's because instead of focusing on her circumstances, she was helping someone else and probably seeing their reaction and seeing how they felt that someone cared for them and looked out for them. That probably made her feel better.
Thank you so much, Cassandra. That's so right. She was being empathetic. She was thinking about others, and it really helped her feel better. So, does anyone want to talk about this scenario and maybe how they feel, any other emotions that you want to speak of that you didn't hear us speak of before we move on? I'm so sorry.
I don't know if Magdala has shared in the chat, and we're so grateful that you shared that information because we saw how you overcame. And I really want other folks to know that 211, that's a telephone line that is always there. If you ever get that low or you just don't feel great, that you will call 211. And also you have in the churches your minister in the health ministry and the youth ministry. So there's help there if you ever feel that way. Sometimes the families are not there and your friends aren't there, but 211 is there. And that number will reach out to you and always be there. So glad, Magdalia, that you overcame and you have a partner in life and life is good like we always know it. But also for other people to remember that 211, you just share that number with your friends and family, that they never get that low, and we'll make it back. All right. Thank you, Magdala, for bringing that up. This is all about helping, and that was so helpful to all of us. Thank you.
Thank you so much, Magdala. I didn't get the chance to read, but 211, if you guys ever feel low, there's someone who you could speak to. And if you ever know someone who's feeling low, you could do your part and you can speak to them as well. So To put everything together, the community service that you guys spoke about earlier, the community service opportunities that Adriana spoke about earlier. We have 2 scenarios, and we're just going to discuss like how we could use our knowledge on COVID, because we all know so much about COVID safety. We're going to use our knowledge, and we're going to use our knowledge on community service, and we're going to come up with ideas on how we can, help serve people. So I want another volunteer, someone who hasn't spoken, to read Jake's scenario.
Jake's brother is a healthcare worker and has been working at hospitals to treat those with the coronavirus.
Okay, so it says that Jake is worried that people he knows will be infected with COVID-19. So much coronavirus. So, knowing what we know about COVID, what we know about serving people, how do you think someone can help Jake in this situation? Like if you were just on the outside, you know Jake's story, what would you do in this scenario?
Maybe explain to him the safety precautions that his brother is taking while at the hospital, and maybe that'll reassure him to know that his brother is actually being safe.
Okay. Kalima, thank you so much. Yes, we will let him know about all the things that we know about COVID, how important it is to be safe. Do you mind sharing, something that you remember, Kalima, before we ask someone else? Like, what would you say if you were talking to him?
Like a quote, I guess. So I would probably say your brother is wearing this specific type of mask for healthcare workers, and he is striving to keep himself safe while, even though it might seem like he's trying to help other people the whole time, he's also trying to keep himself safe.
That's so good. Oh my gosh, look at you, COVID pro. So, what do you think Jake should do in this situation? He wants to feel better. He wants to, have an experience with his brother. He wants to connect, but COVID is a thing. So what should he do?
He should FaceTime him.
Communication is key.
Yes, who said that? I love that. Yes, it's so awesome that we're able to have this communication. Even though COVID is a thing and we're able to go to school on Zoom. I just started medical school. I started on Zoom. So he can speak to his brother through Zoom, and he could have a dance party, do everything he wants, all those cool things. What else do you think he could do? Like just to serve Jake and maybe other people, or his brother, or maybe other people who are in his brother's shoes.
He could like talk to his brother through mail, like sending notes to him, and then his brother responds with notes, and then they just keep doing it.
Yes, I love that. Thank you so much. He could definitely do that. It might cost some money, but it shouldn't cost too much. And, safety first. Doesn't matter how much money it costs. Safety should always be prioritized. And a letter could last forever. His brother could really treasure that. And it'll mean so much and make him so, so, so happy. Does anyone else have any suggestions? If you were Jake, what would you do? Like how else could you serve your brother or other people in your brother's shoes?
They go to a drive-in movie.
I'm sorry, who is speaking?
I said they could go to like a drive-in movie or something, event like that together.
Mm-hmm. Thank you. That's so great. That's so true. They could do that and it's safe. They'll be with their family unit. gosh, what am I saying? Family unit, and it'll be, you know, social distanced and things like that. And movies are so great. I love movies. I haven't seen one in a while because, you know, school. So anyone has any other thing, any other suggestion? And think about this like now, and then think about how you could actually do this like next week, tomorrow, any day. Any last suggestion for Jake?
I know we talked about writing letters and donating to organizations, but another way that I think all of us have been helping is just, especially with healthcare workers, is staying at home and quarantining because you don't want to overwhelm the healthcare system. So following those guidelines helps as well.
Yes. Yes. So it would just be a reminder, education. Like, I believe a lot of you guys spoke about how we can just make sure that we're following guidelines, that we're following all of those things that we've learned about COVID. And through that, you're serving others by not infecting them. Okay. So now we're gonna talk about Amy's situation. I want someone to read the scenario, and now Jake was just an example. Like, Amy, think of her as a real person and think about things that you'll actually do, okay? So who wants to read Amy? I'll get two people, one person for the first box, second box, someone else. Don't all speak at once.
Amy misses socializing and feels very isolated from others.
I could relate. Who wants to read the second box?
Amy lives alone and has been quarantining. She misses her family and wishes she could see her elderly mother. She decides she will continue to quarantine for her mother's safety.
Okay, thank you so much for reading. So now with all of the things that we spoke about today and throughout these sessions, what do you think Amy can do? I mean, before we even go to that, like, can someone speak about how Amy's feeling?
She really misses her family.
Mm-hmm. Yeah, she misses her family. She misses her friends. She misses maybe school. I don't know about you guys. I miss school sometimes, even though it was hard. So what do you think she can do about these feelings that she's having?
She could video call her family.
Okay, she could video call just like Jake. So like, let's think about what she can do in like a community service type spirit. Not to say that your answer was incorrect. I think those are very excellent answers, but just so that we can, you know, give back. So what do you think Amy can do?
Donate to local services like pantries, I think we were talking about.
Okay, thank you so much, Mia. So donating to local pantries. So why do you think she should do that?
It'll give her something to do and somebody to talk to.
Okay. Yes, it'll give her something to do. And in doing that, she might end up feeling, she might have like a feeling that, you know, surpasses that feeling of loneliness, or maybe replaces it and makes her feel a lot better. Anyone else? Just two more people.
She could probably even visit her and just take the safety precautions needed, like stay a distance back, or just be sending her positive messages throughout the day and let her know that she misses her.
Yes. So I did not see who was speaking. So it's very important to follow guidelines. When seeing other people, it's very important to maintain the social distancing, to stay inside with the same people as much as possible. So if she is visiting, it might help if she does something like a drive-through or drive-by. I'm sorry, I don't know which is the proper way to say it. And she might be able to see her family members through the car, and she might be able to have that social connection in that way. So thank you so much for sharing that. Anyone has any last
Also, if you don't have a car and you live in the neighborhood and you walk, or you have a bicycle, you can exercise and you bicycle by, or you walk by and say hi.
So I can relate to that. This is Sister Thomas from Mount Calvary. Hi. I can relate to that because my mom, I haven't actually hugged her or kissed her since March. And what me and my daughter Raven does, we go to her home, we don't go inside, and we stay in her yard, and we speak with her through the door, and we dance and laugh and talk and whatever. So we still social distance while keeping her safe because we're out, and that's how we do.
Wow.
That's a lot of love. Lots of love that you're showing by staying and making sure she doesn't get infected.
Yeah.
That's how you show love. Thank you.
Thank you.
Yes, thank you so much for sharing that.
Can I ask how the kids are helping their parents? How could you help your parents? They're under a lot of stress. What can you do for your parents? Your mom or your dad or whoever is taking care of you? What ideas do you have?
So both of my parents are constantly on Zoom calls, on meetings, and different things like that. So one of the things that we try to do is just take over things that they would usually be doing during the day. So instead of my mom having to cook dinner, which isn't really normal, we cook dinner, but we'll cook dinner or we'll make sure it's cleaned up in certain areas. I'll set up my dad's Zoom calls if I know he's rushing in the house to try to get everything together. So yeah.
Wow, Karima. See, you're thinking about others, you're thinking about your parents, and you're not just putting your feelings, first. And you're able to make a difference in other people's lives. And I'm sure that it has maybe helped you feel a lot better, even though that we're in this time of COVID. So thank you so much for helping your parents, and thank you so much for sharing that. So does anyone have any last words, any last contribution that they would like to share?
I wanted to share that we always talk about social distancing, but I remember someone mentioning that think of it more as physical distancing, having that physical 6 feet plus between yourself, but still trying to keep that social support system. So within your churches, speaking to your fellow youth members, your family, friends, whatever it may be, if it's through Zoom or letters, just keeping that social support is really important during this time.
Yes, I agree. We're distanced, but socially we're like we are right here. We're still able to be together. So I know COVID, it's been a very long time quarantining, but that doesn't stop us from, being out in the community or not out in the community. We're inside of our homes, but it doesn't stop us from sharing love. It doesn't stop us from sharing community. It doesn't stop us from speaking to each other, from learning. Look at us. We're learning still, and we're able to have all of these nice conversations. So I just want you guys to remember about all of the guidelines that we've spoken about, all of the ways that you can be safe, all the ways that you can give back, really make sure that your mental health is, that you realize that you might be feeling certain feelings. And like we spoke about earlier, if you want to talk, there's a 211 number. And please, 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 please remember that you're never alone, that you have a community of people who really care about you guys, and we are even a community. So that's all I have to say today for you guys. I don't know if anyone else on the team has anything to add.
If we could go to the last slide to show the attendance QR code and link, that would be great. I just want to thank everyone again. Thank you for joining us over these past 6 virtual sessions. Thank you for your participation. Thank you for teaching us things and sharing with us and feeling comfortable to come here and talk with us, and for us learning from each other and with each other. And I hope that you've gained something from this. I hope that you share the information with other people at your church and throughout your community. And I hope to see you in future sessions that we're planning. We're planning future things, and we will look forward to including all of you in those. So Gamily just posted the link. Please don't forget to record your attendance, because we do still have those big prizes at the end. We mentioned at the beginning, you have the bronze level, the silver level, and the gold level. So we're going to go through all of the attendance surveys to figure out who attended all 6 of our sessions, who attended 4, 3, etc., and send those prizes along.
And I have to thank all the churches tonight. Eden's Seventh-day Adventist, Mount Bethany Seventh-day Adventist, Mount Calvary Seventh-day Adventist, Muhammad Mosque 29, 93rd Street Missionary Baptist Church, New Providence Missionary Baptist Church, Miami Bethany SDA, and I know I saw Metropolitan on also, Metropolitan Baptist, and Friendship Missionary Baptist. I hope I got all the churches on. This was excellent that so many of you came on tonight. And I know you'll take this information back to everyone. And as Chantel says, I'm seeing lots of great job. Lots of everything in the chat. Thank you very much for FIU Student National Medical Association for doing a fantastic job in the series. Thank you for all the presenters today. We couldn't do it without the team, without the community. And as we said, community is always here. SNMA, Keeping the Faith. I saw Marie Etienne on from the Haitian American Nursing Association, the Haitian Association of Faith-Based Network, the Black Nurses Association. We, just many groups have come together to make sure that you know that we're here. We're trying to keep everyone safe and keep everyone protected from coronavirus. So until there's a cure or real effective vaccine, that we're all here to celebrate and keep our lives. And as Magdala said, God is good. And that's why we're working through our churches to keep that alive, that God is good and we're all here. So thank you very, very much. And I see Marie Etienne has something.
Hello.
New Providence Missionary Baptist Church. Thank you for coming on too.
What about Église Évangélique de Dieu?
Oh, I don't see that in the chat, but Église Evangelica, thank you. Wow, we've got 15 churches on, or 12, I lost the number. But we have a total of 30 churches that we work with, but today was excellent. Thank you.
Did you send her the same link you sent me? Did you text that to her?
Yeah, we texted to everyone.
She said.
What is it?
The attendance, don't forget to do the attendance.
Okay.
All right.
All right.
So I think I've thanked everyone. I don't know if there's anyone. Chantel Roll and your leadership of the SNMA has been fantastic. Thank you. And is there anything I've missed? We will be in touch if there are more sessions. Please ask your church if they want these sessions that we've recorded. We will share them with you. Okay? So Chantel, you're on.
Yeah, just have a good night, everyone. Don't forget to fill out the attendance. We're going to send out gifts for participation and the final gift prizes for bronze, silver, and gold. Stay safe.
Does every church on get a certificate? We'll see. We'll send out some prizes. We have everything. We'll send it out today. Thank you. Keep the faith, guys, to fight COVID-19.
Yes.
All right. Good night.
Good night. Dr. Holder, do you